This is ZTN News on the go, and today we're at the Rainbow Towers in the capital, where the Ministry of Health and National AIDS Council are hosting the Zimbabwe National HIV and AIDS Strategic Plan, ZIM'S 5, 2026-2030 stakeholders validation meeting. The ZIM'S 5 comes after ZIM'S 4, which over the past 5 years saw Zimbabwe achieving remarkable strides in its HIV response. The period also came with significant challenges, among others the economic shocks, pandemics, climate change, among other challenges. And today now we are joined by Zimbabwe AIDS Network Director, Mr. Tsuro, to probably just unpack for us how critical this meeting is.
Thank you very much for this opportunity. Yes, this is a very important document that will assist us as civil society. I represent civil society, 200 to 300 civil society organizations in Zimbabwe, across all the countries, the provinces that we have in Zimbabwe. So this document is guided by and informed by this strategy. And input for civil society into this document will help us in the complementarity areas that we wanted to do with the National AIDS Council, Ministry of Health, and other players that we work with within the response to HIV and AIDS. Thank you.
This comes after the ZIM'S 4. What were the challenges, the gaps that were identified that you seek to address under the ZIM'S 5?
One important thing that I would want to speak to, that was a gap in the last ZIM'S before, was around the pediatric HIV. If you look at the indicators around the 95, for children, you find that they are in the 60s, 70s. And that is a gap that we want, then it means we are going to win the war as we fight to end AIDS by 2030.
Thank you so much for your time and have good deliberations. We are also joined by Zichire Director Walter Chikanya, who is also part of the key stakeholders attending the ZIM'S 5 validation meeting. How critical is this meeting? I know it comes after ZIM'S 4. What are the thorny issues that probably and gaps that were not addressed in the previous in ZIM'S 4 that you really feel ZIM'S 5 should cover?
To guide all our programming as we churn into 2026, and as you know, also we're looking at 2030 ending AIDS, which is very critical. So we need to be able to be very specific and make sure that we target those issues that actually bring real change. I mean, from ZIM'S 4, we have seen, and I'm happy that the consultants have also mentioned that men are still missing. We still have that gap. So I feel that's a real critical area that we should target now and make sure that men are addressed. Make sure that all the needs that we have that pertain to men are addressed. Because there are also a lot of issues that then come with that. Cross-cutting issues. We're looking at also looking at issues, in a way that we know that we're not leaving anyone behind. I think ZIM'S 4 to ZIM'S 5, we're also looking at integration. We can't be approaching our interventions in silos. Integration has been called to be very critical. CLM data, we need to think about integration so that our interventions speak to each other. Layering of critical interventions and services that we need to give out to men and boys. Thank you so much. Yes.
We also know that Zimbabwe has not been spared by funding cuts. Probably what should Zimbabwe do in the face of those funding cuts to ensure that
resource mobilization? And again, looking at ZIM'S 5, issues that have been raised, issues of sustainability, issues of health financing. So we need to really be thinking of, we can't be relying on external funding alone. We also need to think about domestic funding. So this is a critical time, and I'm happy that Ministry and National AIDS Council are talking about this, because these are some of our key partners who are looking at critical issues as far as domestic resource mobilization is concerned, looking at social contracting, also looking at critical taxes that we have, airtime levy, taxes that have been earmarked, to then save our health sector. So I think it's very critical at this stage to think about health financing and sustainability.
Thank you for your time. Thank you, Walter. We are joined by National AIDS Council Chief Executive Director.
Thank you. We are here today. We are holding what is called a validation meeting for the Zimbabwe National AIDS Strategic Plan 5, the fifth one, which will cover the period 2026 to 2030. So the importance of this meeting is that we have brought all the stakeholders in the HIV sector. We have brought all of them together. These include living with HIV organizations. So we are here together to look at a draft document which has been put together by a team of consultants. These consultants were chosen because of their expertise. Basically, they looked at the previous strategy, which covered 2020 to 2025. And they've done an evaluation and a review of areas where there are still gaps. So the idea was for them to then look at the current environment and look at the future, the issues which might affect us as we go towards 2030 and as we also go towards the vision of 2030, which is to end AIDS as a public health threat. So the work which we are doing today is to review the interviews with key informants. So this document which they've come up with is divided into thematic areas, which they've really gone granular and they've identified the gaps, which they think if we now come up with the strategies, we should be able to then parities amongst geographical populations, amongst, if you compare men with women, if you also look at children, if you look at our health information system, if you look at our health financing. So they've found gaps and challenges, and then that will then make the document, the strategic plan for 2026 to 2030 complete.
This planning meeting comes at a time when Zimbabwe has not been spared by donor dwindling funding cuts. Is it something that you're going to cuts?
Yes, so that's one of the critical things which has come up, the issue of resource mobilization and sustainability of the HIV program. Because we know what has happened globally, that the funding has reduced. And this document should look at the issue of funding, especially we should have come up with ideas and solutions to fill in the gap which has been created, especially the US government funding, which is almost disappeared, so that they can also proffer solutions going forward.